Hi, I'm Dr. Lindsey. Let me take you through how we design a hairline for a 25-year-old fellow with really good hair to work with, meaning thick, curly, non-color contrasted hair that is a pleasure to plant. So here he is when he walks in. He's 25, he's the same age as my son. And so the first thing is nobody needs to do a hair transplant. And these younger guys, including my son, I'm used to the mindset of a 25-year-old. I mean, shoot, I used to be a 25-year-old. You need to think this through and make sure you want to do this. And we're always happy to have a parent come along. I mean, I know a 25-year-old is an adult. They don't have to do anything like that. But I find that in our repair cases that we have to do, all these younger guys, and even some older guys, get talked into something by some salesperson, and then they regret it or they didn't make an informed decision. So you're welcome to bring a parent, girlfriend, boyfriend, brother, whoever you want, that way to your initial consultation. That way you have two sets of ears and you can think things through and bounce ideas off of the person that's with you. So anyhow, here he is when he came in, and he looks unremarkable. However, his complaints, and I understand it, is that he's got too mature of a hairline and it's thinning and working its way back. And on history, he tells me that his dad is a class 2 hair loss. That's about what I am, and maybe a little bit more than that. And his mom's side of the family doesn't get that much worse. They're a class 3 with a bald spot. So the odds of him going really bald are not zero, but they're not very high. And so for somebody like him, I would say he has the freedom to spin those hairs in the back of his head kind of how he wants to. Had he had a different family history, meaning everybody's class 6 or 7, I would tell him he should put this off until he's significantly balder, and then maybe we can reconstruct a hairline like he currently has. But he may not have enough hair to accomplish his goals if his family history is really bad. So anyhow, with his family history and his good hair to work with and his excellent donor density, we came up with this plan. And if you look, this is still not a 25-year-old's hairline. However, it's a hairline that'll look okay when you're 25, probably better than his current, more mature hairline, and it'll look okay when he's 35, 45, and 55. It's not a straight line across the front of his head, and if you look carefully, there's some irregularities that we put in. So again, it doesn't look like a straight line. Nobody wants to have a good hair transplant noticed. They want to have an unremarkable hairline and people notice your face. Similar to when we do noses. Nobody wants to have has a great looking nose. People don't want you to notice their hairline nor their nose. They just want to be perceived and talked to. So then the issue is, how do you get the hair out of the patient's head? And this young man chose a strip. Frankly, he could have done either a strip or FUE. He has really good hair to work with. He needed a finite amount of hair, meaning 2,000 grafts or less. And I think that either one would work almost as well. He chose a strip, and so we cut a 1.5 centimeter strip out of the back of his head, closed it up in 2 layers so that there's some stitches underneath the skin holding it together, and then the skin stitches come out about 6 days later. And done correctly, in a patient who heals well, hairs grow across that scar to conceal it. So we get all kinds of calls from people asking how many hairs are we going to put in your head, or Joe's hair clinic said you needed 4,000 hairs. It's not really the number of hairs that you need, it's the number of grafts. And that is because different people have different densities and different amounts of 1, 2, and 3, and 4 hair grafts. And essentially we need enough grafts to give you an unremarkable hairline that doesn't look pluggy. And then behind that, we need enough grafts to give the bulk, to give a good hair transplant result. Because the idea of a hair transplant is not to cure you of baldness. When you arrived on Earth, you had 100,000 hairs on your head. And by the time you're looking at this video, you certainly lost some of them, and some guys have lost most of them. And so you're constrained by this amount of hair back here to cover the top of your head, and you can't cover it in the density that you arrived on planet Earth with. So what you're doing is you're putting in enough hair that you can style and conceal your hair loss. So now we're at the front of his head, and if you notice, we've shaved a little bit into his good and already existing hair, which is thinning a little bit at that edge. And that's so that even though we don't think he's going to lose a lot of hair back in here, if he loses a little bit, he doesn't end up looking like an Oreo cookie with real black hair here, some lighter skin, and some dark hair that's his native hair. So we shave a little bit into that good hair, make some holes there, and put grafts in there. Again, just not as a preventative issue, but just to conceal any thinness that might happen in there over the next couple of years. So now we've made the holes, and assuming we started at 7 o'clock, the holes are made, and the patient's gotten up and gone to the bathroom, had another Valium probably, texted with their mother or friends, and then we start putting hair in. It's really as fast as the technicians remove the hair follicles from the graft and place them in cool saline cups. The other technicians insert those grafts in. And it's very similar to planting a tree. For example, here's a hole in the ground that I've dug at my house. When you plant a tree or a bush, you dig the hole slightly shallower than the plant is. Pretty similar to that with a hair graft. And the graft or the plant is placed in the hole, and then it settles down over the next 2 weeks or so with plants and 24 hours or so with hair, so that the plant looks like this. And then here's his case at the end of the procedure, and if you look carefully, there are some white things that are sticking up, and that is just the top portion of the root. Remember, here's what the root looks like. It's just the top little bit, and it'll settle down over the next 24 hours. And if you look at this, you can see the single hair grafts are at the edge, and the 2 or 3 hair grafts are back at his native hair. Again, so it doesn't look pluggy, but it gives the bulk that he needs to achieve an unremarkable hair transplant. So we prefer people to come every day for a week, for 6 days, for us to help you clean it. Because what happens is, it's a wound with, in his case, roughly 2,000 holes, and those holes will ooze a little bit of fluid, much like when you skin your arm or your leg. It makes this oozy stuff. And the good part of the oozy stuff is it holds your grafts in place really after a day. It's very difficult to pull a hair out. The bad part is that if you keep oozing, it'll ooze out and it'll form this adherent sheet that will tend to pull hairs out. And so we want you to come daily, and we'll help you clean it for a week, so that at a week it looks nice and clean like this and no hairs have been pulled out. I think that does make a big difference. And then we have patients come back at a month. And so here at a month, most of the hairs that we put in have fallen out. His donor scar is completely concealed by his half-inch long hair, and his scar is a thin red line with hair starting to grow through it. And it's only pink because of his age. When you're older, the pinkness of wounds tends to go away very quickly. And so typically at 3 or 4 months that pinkness is gone, and most people, the older you are, the faster it goes away. So we had him come back at 6 months, and he looks really good. You can see that his hairline already looks fine. There's some spaces that there aren't any hairs, and people will often ask, so what's going to happen over the next couple of months? Am I going to get more hair, or the hairs there are going to get thicker? I don't know. I can tell you that it's a bell curve. Not all hairs erupt at one time, and just like a plant, the top part of the tree is skinny and it tends to thicken up as it grows out. And the final result typically is around 15 or 18 months. The difference really between 13 and 18 months isn't much, so we tell people to come back at 13 months to get their final picture. And that's usually a reasonable time to take a final picture. Occasionally people grow a little slower, and a couple times a year I get an email from somebody at 18 months that says it looked way better than it did at 13 months, and they already look good. So I honestly don't know what really happens between 6 and 13 months, except that things improve. Probably more hairs erupt that are still in their rest cycle, and probably the hairs that are there will get thicker. And when you look at this hairline from the side, it just does not look artificial, and that is the whole goal. We don't want to plant a Christmas tree farm. We want you to be driving by a natural forest of hair. And then finally he comes back at a little bit over 13 months. And that looks fantastic. I think you can scroll back to the 6-month picture and you can see that a few of the spaces that he had are gone. And his hair is just, it does look better. At 6 months he looked fine. I would have been really proud to show him as a final result at 6 months, but I'm prouder to show his results at 13 months. And his hairline when combed back, again, doesn't look pluggy at the edges. Part of it is he's got such great hair to work with, but part of it's the technique where we pack things as tight as we can. And here is from behind, and a close-up of his scar line. Really, it's difficult to see. He's somewhere better than that line, which is my average, but not quite as good as that line. So more than likely 0.8 of 1 millimeter wide with hairs going through it. He could most likely get by with a buzz cut. So what are the takeaway messages of this? Number one, there's never a rush to a hair transplant. Feel free to bring other people to the consultation so that you don't get talked into anything. We don't have salespeople. You end up talking with me, and oftentimes with Wendy, who's been with me for 20 years. You need an age-appropriate hairline. One that will look okay, whatever age you are now, and one that will look okay as you age. Strip and FUE have pros and cons. Talk them over with your doctor. Keep it clean post-op. And if that means come to the office and get clean, we'll do so. Be patient. It takes a while for these things to grow. I can't tell you how many people I've seen over the past 29 years now, 29 years and 6 days, that have said, you know, I just was certain at 4 months that I made a big mistake. And at 6 months, I was pretty happy, and at a year, I knew I made the right choice. Be patient, do your research, and if we can help you, please give us a call. Thanks.